Hello everyone, this is Dr. Sushma Sarilla, consultant homeopath at Fidicus Homeopathy. Today we are going to discuss a topic called as bulky uterus. So remember, bulky uterus is not a disease or a pathological entity of its own. It is always occurring along with other female reproductive diseases. So why are we discussing about a sign which we find in USG and not a disease? Remember that many people, many women find or have this bulky uterus in the USG scan and they're alarmed. Sometimes they opt for surgery when it is not necessary, and sometimes they just don't do anything about this bulky uterus and it will go into a bad prognosis. So then let's dive into the topic to know more about bulky uterus. What is bulky uterus? Remember, bulky means enlarged. So even in the physiological form, that is even in healthy form, the uterus is enlarged where it is pregnancy. In pregnancy also the uterus is enlarged. But apart from pregnancy, if the uterus is enlarged, that means thickness is there or it has grown a lot and it is causing this heavy feeling, that is called as bulky uterus. A bulky uterus is essentially an enlarged uterus. It is usually common in pregnancy, but there are other times when it might increase or the uterus size may increase because of different reasons. Coming into the signs and symptoms of bulky uterus. So what are the signs or what are the symptoms that you find in bulky uterus? Primary thing what you find in bulky uterus is heavy feeling in the lower abdomen area, and also there is bearing down sensation. It means that there is something heavy in your abdomen and it is pulling down. This sensation is always present in bulky uterus. And also remember, see, bulky uterus can be divided into two types. The primary one where the uterus is not too much enlarged, in that you might not find a lot of symptoms, but in enlarged and a little bit more thicker or enlarged uterus, you will find symptoms, primary being the heavy or the bearing down sensation. Second thing, what you will be finding is prolonged bleeding or prolonged menstruation, and also you will be having chronic pelvic pain. And along with that, there is pain which is radiating to the back, that is pain in the front of the abdomen which will go back to the back. Okay, and not only that, you will be having backaches, bleeding post-menopausal. After the menopause has been attained, you can see bleeding which can be dangerous. So you can see bleeding in post-menopause also, and irregular vaginal discharge. Not only that, there is pain during sexual intercourse, and also there is pain during urination. If the bulky uterus is too much enlarged and causing pressure on the urinary organs, you will have pain even during urination as well. And not only that, there is palpation. When you palpate, when the doctor palpates the lower abdomen, they will be able to find a mass around the lower abdomen. And also because of the prolonged bleeding, there will be anemia in the CBC, that is complete blood count. And also physically we can see, because there is pale waxy appearance of the skin, that means there is no luster or glow in the skin because of lack of hemoglobin or decreased amount of HB. And also there is frequent urination. Not only there is pain during urination, there is frequency because there is pressure on the urinary organs which is causing the urinary organs to spill the urine frequently. Now let's go into the investigations part of bulky uterus. The primary investigation or the primary thing that any person who is suffering from bulky uterus should do is get clinical evaluation. So what is clinical evaluation? When you visit a doctor, they will be asking you first about your symptoms. What are the symptoms that you're presenting with? And not only that, they will do a bimanual examination, bimanual pelvic examination if needed, and they will suggest you for the investigations. So what are the primary form of investigations? Are the imaging techniques, that is ultrasonography. This is the primary and the most thing that the doctor advises if you feel or if they feel that you are suffering from bulky uterus. So in the USG, you will be finding bulky uterus. But if they need a little bit of more information regarding that, then they might suggest you with an MRI. So that will give you more crucial information that is not present in your USG. And also hormonal and blood test. Remember that when you visit a doctor or when you're coming to us, we will analyze your case, and regarding the symptoms, relating to the symptoms, we will tell you about the investigations. Not all kinds of bulky uterus symptoms need certain investigations. For example, if you're suffering from hormonal imbalance, you will be presenting with either irregular menstruation or prolonged menstruation, or you're having fertility issues. then we will ask you to get your hormonal and your blood test done. If you're having prolonged bleeding, then we will ask you to get your CBC done, which is complete blood count, where we will be able to see your HB count. And not only that, we will be able to analyze if there is iron deficiency. And not only that, and then after the complete blood count, you will be asked to do your thyroid profile. Why thyroid profile? If there is irregular menstruation, if there is one menstruation or one bleeding where it is very low and the other one is prolonged, there is irregularity in the menstruation, then we will ask you for your thyroid profile. And if you are having fertility issues and if we feel that it is always associated with PCOS, then hormonal profile. We will ask you about your hormonal profile. In the hormonal profile, if there is any fertility issue, then your prolactin needs to get done, and then estrogen and progesterone for the endometrial thickness, and also FSH and LH for your ovarian function. Next, coming to endometrial evaluation. If there is postmenopausal bleeding, that means there is something fishy. So if there is postmenopausal bleeding, then we will ask you for endometrial analysis, that is endometrial biopsy. Remember, postmenopausal bleeding, endometrial analysis or endometrial biopsy. And then coming to hysteroscopy. If there is something, if there are uterine abnormalities found in the MRI, then we will go for hysteroscopy. Additional tests. If there is bleeding on touch, that is, if there is bleeding even while examination, on touching the finger to the cervix, this is the cervix, and during bimanual examination, just the touch of the finger or touch of an instrument is causing severe bleeding, then that is just for cervical cancer. So we can get a pap smear done. So these are the additional tests that need to be done in bulky uterus. Now let's get into the structure and function of the uterus to know in detail where it is going wrong and how it is going wrong. Structure and function. Remember that the endometrium consists of two primary layers, the functional layer and the basal layer. As you can see, this is a healthy uterus. There are two linings in the endometrium. The innermost lining of the uterus is called as endometrium. The middle lining is called as myometrium and the outer one is called as perimetrium. So this endometrium is the main crucial part we need to discuss in bulky uterus. So what is happening in this endometrium? The endometrium is of two layers, okay, remember. This is the basal layer, which is the basement of the endometrium, and this is the functional layer. So whenever there are hormonal changes, the basal layer will help in production of the functional layer. The functional layer will get thick and then it is anticipating for pregnancy. If there is no pregnancy, this functional layer is ripped off and that is called as menstruation, and the basal layer stays there. So this is the normal function and structure of the uterus. Remember that this endometrial thickness will help in implantation of the zygote or of the baby. It will help in holding the baby in the uterus. The thickness of the endometrium will determine if it is healthy or not healthy. Now let's discuss about the causes and risk factors for bulky uterus. Remember, one risk factor is common for almost all the diseases, that is lifestyle problems. That is, it can be diabetes, it can be anything related to your hormones, it can be sleep issues. All of this come under lifestyle disorders. Okay, so bulky uterus is also one of the component of lifestyle disorders. That is always a risk. Not having proper sleep or not consuming proper food, not having diet or exercise properly can lead into all of these hormonal changes, which can in turn lead into different diseases and also bulky uterus. So what are the main causes of bulky uterus? Remember, as I told you in the starting of the video, bulky uterus is not a separate disease. It is a common sign which is found in many diseases which are occurring in female reproductive issues. Okay, so the first one is fibroids. What are fibroids? Fibroids are benign growths in the uterus. So this fibroids can cause bulky uterus. Remember that fibroids are growths inside or outside near the uterus. It can form in the perimetrial region, myometrial region, or in the endometrial region, which is subserosal, submucosal, and intramural fibroids. All of these fibroids can draw the blood flow a lot, leading to increase in the endometrium. So this is one of the causes for endometrial hyperplasia or bulky uterus. Next one is adenomyosis. What is adenomyosis? If you can see in the picture, as I told you, the inside lining of the uterus is called as endometrium. If this endometrium is going inside the muscle layer, then that is called as adenomyosis. This can also cause bulky uterus. So adenomyosis is nothing but a tissue which is growing, endometrial tissue which is growing inside of the uterus. And then ovarian cyst and polycystic syndrome. See, remember, either if it is ovarian cyst or polycystic syndrome, there is hormonal disruption which is leading into endometrial hyperplasia, leading to bulky uterus. And also endometrial cancer. This endometrial cancer can also present itself as bulky uterus in the primary stages. Perimenopause. What is perimenopause? Perimenopause is a phase where there is hormone fluctuation severe. You have not attained menopause and you are in this middle stage where there is no regular menstruation and there is no stopping in the menstruation. That part is called as perimenstrual stage. It is usually around 45 to 50 for some people or 42 to 46 in some people. Okay. So this perimenopausal stage, because of the differences in hormones, can cause bulky uterus. Coming to improper lifestyle, which is always a risk factor. Coming to the body changes or the pathological outlines. What is happening inside the body that is causing this endometrial thickness to increase? And what is a normal endometrial thickness and what is the pathological endometrial thickness? Let's dive into the body changes to know more about it. As you can see, this is the uterus or the female reproductive organ. These are both the ovaries, these are the fallopian tubes, and this is the uterine part. So today we will be discussing in depth. So as I told you, fibroids can cause endometrial hyperplasia. Fibroids are growths inside. It can be subserosal in the outer lining, or it can be intramural inside the muscular layer, or it can be submucosal, which is growing inside the uterine cavity. So these fibroids have a tendency to increase the blood supply to the uterus. Whenever there is increase in blood supply to a certain part, obviously it will grow. So the endometrial thickness will be enlarged in fibroids. So what is the presentation? If you are suffering from bulky uterus and you don't know what are the major causes, or if you are feeling a sensation of heaviness in your lower abdomen and you have not got your USG, you can analyze through these symptoms. If there are fibroids associated with bulky uterus, what will happen is you will have prolonged bleeding, you will have pain during intercourse, and also you will have this bearing down or sensation where there is something heavy in your lower abdomen. These are the symptoms which present along with fibroid. Now coming to the adenomyosis part. This endometrial layer, if it goes inside and grows in the muscular layer, then that is called as adenomyosis. So in adenomyosis, what are the conditions? You will have severe pain along with heavy bleeding. This is adenomyosis. Next, coming to ovarian cysts, which are cysts formed in and around the ovary, or PCOS. These are also small multiple cysts. So what happens in PCOS and in ovarian cysts is that they will have severe dysmenorrhea or painful menstruation, but along with that, they will have irregular menstruation. Sometimes it can be very little, sometimes it can be too much, sometimes there is no menstruation for 3 to 4 months, sometimes there is prolonged bleeding for more than 1 month. All of these disruptions are caused by ovarian cysts. And in PCOS, this irregularities along with excess androgenism, that is hair near your chin area, your chest or the back, along with polycystic ovaries and irregular menstruation can also be the cause for endometrial thickness. The next one is endometrial cancer. In endometrial cancer, you will find that it is not regular. The bleeding is abrupt, especially vaginal bleeding, which is abrupt, which is mostly found in menopausal women. If there is bleeding after the menopause has been attained, you have to get a checkup with the gynec. Next, coming into the perimenopausal state. In the perimenopausal state, the hormonal fluctuations are too much. That is, there is excess and lowing of certain hormones which will cause endometrial hyperplasia. As we have already discussed the causes, Now let's see, because in all of this there is one problem, that is increased estrogen level. This increased estrogen level will have an effect on the endometrium which will cause it to expand. Okay, so estrogen will help in expansion or proliferation or increase in thickness of the endometrium, and the progesterone will maintain that thickness. So what is happening in all of these diseases is that there is increased estrogen or hormonal fluctuations which are leading to thickness in the endometrial layer. So what is the normal endometrial layer thickness? Remember that the endometrial thickness will tell you if you have bulky uterus or not. During menstruation, if you get a USG done, the endometrial thickness should be 1 to 2 mm. If it is during the follicular phase you are getting your USG done, then the thickness should be around 5 to 7 mm. And then if you're getting it in the luteal phase, that means after the ovulation has been done, that is called the luteal phase. If you're getting it done then the endometrial thickness should go up till 16 mm. Having more endometrial thickness, that is more than 16 mm, or in the menopause era, if you are having endometrial thickness of more than 5 mm, it is suggestive of bulky uterus. Now coming into the conventional treatment part of bulky uterus. The primary thing that anyone will suggest is hormonal pills and NSAIDs. As I told you, pelvic pain or pain during urination is the common feature of bulky uterus. So NSAIDs, that is non-steroidal anti-inflammatory drugs for the pain to subside. Remember, if you are taking NSAIDs, you always have to take it with the proton pump inhibitor, that is your pantoprazole, rabdiprazole or your isomeprazole. And these proton pump inhibitors, if you're taking for a longer period of time, will have a bad effect on your GIT tract. And also NSAIDs target your numbness, that is, they'll make you numb to the pain. They will not target the pain itself. And also hormonal pills. These hormonal pills will just manage the symptom but will not cause an end to it or put an end to the problem area that you're suffering from. Intrauterine devices, IUDs. As you can see in the picture, many people have these IUDs. So what do these IUDs do? These intrauterine devices, little bit by little bit, they release a hormone called as progesterone. Okay, this progesterone or the hormonal combination will help in maintaining the hormones. But as soon as you remove this IUD, the problem will again arise. So this is not the complete solution. It is just a temporary solution. And also certain times, if the IUD is not placed properly, this thread can come or get inside, and also the IUD can misplace, causing perforation or a hole in the uterus. Next, coming into the surgery part. Many people, if they know that they have bulky uterus, and when they consult, the first thing they will tell is get something with the surgery, that is myomectomy, where they will be removing the fibroids. Remember that myomectomy, that is removing a certain growth, is just removing the symptom of the disease, but it is not triggering or it is not addressing the cause of the disease. And next, hysterectomy, that is complete removal of the uterus, which can cause osteoporosis at an early age. And also uterine artery embolization. What does this surgery mean? It means that they cut off the blood supply to the fibroid which is growing inside the uterus. Remember, even it can be endometrial ablation or IVF treatments. They are just concerned about the symptomatology part, but they are doing nothing for the triggering part, which is hormonal imbalance. They are just giving hormonal pills, which will just maintain that area. Once you stop the hormonal pills, the disease will reoccur. Coming to the homeopathic treatment part, why should you opt for homeopathic treatment for bulky uterus and not opt for conventional methods of treatment? As I already told you, they are just pointing at the symptomatology part. The symptoms are having fibroids, having pain and all of that. They are giving medications just to relieve that pain or surgeries just to cut it off. But the trigger is always there. So in homeopathy, we do not have any sort of side effects. The medicines that are present in homeopathy are utterly safe to use, and also they are timely and holistic in nature. We take your whole case, we analyze whole of your case as an individual case. That is, we do not give medicines of bulky uterus just to anyone who are suffering from bulky uterus. But your case will be analyzed, and individual medicine which is especially tailor-made to you, which will fit your needs, will be given to you. So you're curing the hormonal balance or you're maintaining the hormonal balance, By maintaining the hormonal balance, the fibroid size or the PCOS will decrease, and not only that, there will be overall health. You are not taking away any organ, or you are not cutting off any organ in surgery. You don't have to go that far if you're using homeopathy in the prior form itself. And also, there are no hormonal pills. It balances your hormones, and also it is very great for controlling excessive bleeding. Here at Fidicus, when people come to us with these symptoms, the high success rate always tells that homeopathy is a great option for bulky uterus, and it treats the cause. It prevents furthermore remissions or reoccurring of the disease. It relieves your present symptoms, and also it helps in curing your disease. What are the precautions for bulky uterus? As I already told you, it is one of the lifestyle disorders. So what happens is that whenever you are having bulky uterus, people feel that we should not exercise because we are having a lower, or we are having pain, and we are having this bearing down sensation. Remember that this bearing down sensation is occurring because your pelvic floor muscles are not strong. If you start doing Kegel exercises which target the pelvic floor is like a hammock. It will protect all your organs. If you're strengthening this, then that part of a symptom will become more negligible. And not only that, eating a lot of fibrous food will help in clearing your gut area, and also exercising daily. By exercising or working out, I do not mean doing a lot of cardio or jumping, which is not advised in bulky uterus symptoms. But what should you do? You should do strength training little by little, build your muscle little by little, avoid jumping, avoid running, little decrease your cardio and increase your muscle strengthening programs or muscle training programs. Increase diet which have a lot of protein in it, and also do not stress out, because stressing out will cause hormonal imbalance, which will again cause or maintain the bulky uterus. If this bulky uterus is not addressed at a proper time or no medication is taken, it can lead into uterine cancer, which is a rarer case. So if you are having prolonged bleeding, or if you are having postmenopausal bleeding, or if you are having irregular bleeding or mid-menstruation bleeding, then do consult doctors so that you will get your problem assessed properly. Coming to the consultation part here at Fidicus, if you are suffering from bulky uterus, or if you are suffering from any female reproductive problems and you want a proper cure, here at Fidicus we are offering you with two different types of consultations. The first one is online consultation. If you're not near our nearest branches, you can consult us online through two options. One is the audio consultation, second is the video consultation. And you can share whatever investigations that you have with us, and if we need anything more, we will suggest you. After doctor consultation, you need not worry about the medication. Your medication will be delivered to your home within 3 to 5 days if you're staying in India, 3 to 6 days if you're staying in USA, and 4 to 8 days if you're staying anywhere else. If you're staying near the nearest branch of Fidicus, then you can come and consult us in person. If you're suffering from any of the female reproductive organ diseases and you would like to get in touch with us, you can consult us through this number. You can call us, WhatsApp us, or message us through this number. If you're suffering from bulky uterus or any of the female reproductive organ issues and you're looking for a proper cure, why should you choose Fidicus Homeopathy? Here at Fidicus, it stands for highest chance of health, and we are having three principles that we follow. Remember that we have already had bulky uterus cases with high success rate, and also the treatment we give here is proper, and there is no gray area between the patient and the doctor. It is always black and white. That is we stick to the rules, and also we will explain it to you if you have any sort of doubts. The personal care that we give here, if you're having any sort of doubts, you can discuss it with us, and we are here to help you. The personal care at Fidicus is top notch. If you want to choose homeopathy, if you're looking for a proper treatment, and if you're looking for cure, choose Fidicus Homeopathy. Thank you.